Question 1. A 34-year-old male is admitted to the burn intensive care unit after being trapped in a warehouse explosion. He sustained deep partial thickness and full thickness burns to the anterior chest, both upper extremities, neck, and face. The emergency department estimates the total body surface area, TBSA, burned at 42%. The client weighs 80 kilograms. Upon arrival to the ICU, the nurse notes hoarseness, carbonaceous sputum, singed nasal hairs, restlessness, and increasing respiratory effort. Vital signs are BP 94/58 mm Hg, HR 138 per minute, RR 32 per minute, and SpO2 91% on 15L non-rebreather mask. Which nursing action is the highest priority? A. Begin Parkland formula fluid replacement using lactated ringer solution. B. Insert 2 large-bore 4 catheters for aggressive fluid resuscitation. C. Prepare for endotracheal intubation and airway stabilization. D. Administer 4 opioid analgesics to decrease metabolic demand. Answer. C. Prepare for endotracheal intubation and airway stabilization. Rationale. The client demonstrates classic signs of inhalation injury, including hoarseness, singed nasal hairs, carbonaceous sputum, and worsening respiratory distress. Airway edema can progress rapidly after thermal injury, making early intubation the priority before swelling obstructs the airway completely. Fluid resuscitation is essential, but follows airway stabilization in ABC prioritization. Question 2. A client with 55% TBSA burns is receiving fluid resuscitation during the emergent phase. For hours after admission, the nurse reviews the following assessment findings. Urine output 18 milliliters per hour, HR 142 per minute, BP 82/48 mm Hg, CVP 1 mm of mercury, and cool mottled extremities. Which intervention should the nurse anticipate first? A. Decrease 4 fluid infusion to prevent pulmonary edema. B. Increase crystalloid infusion rate as prescribed. C. Administer 4 furosemide to improve renal perfusion. D. Restrict oral intake to reduce third spacing. Answer. B. Increase crystalloid infusion rate as prescribed. Rationale. The client demonstrates inadequate fluid resuscitation with signs of burn shock, hypotension, tachycardia, low urine output, and poor perfusion. During the emergent phase, massive capillary leakage causes intravascular depletion. Increasing isotonic fluid replacement is the priority to restore organ perfusion and prevent acute kidney injury. Question 3. A nurse is caring for a client 24 hours after sustaining severe burns involving 38% TBSA. Which laboratory finding requires immediate nursing intervention? A. Hematocrit 58%. B. Sérum potassium 6.2 MEQ/L. C. Sérum sodium 132 MEQ/L. D. White blood cell count 15,000/mm superscript 3. Answer. B. Sérum potassium 6.2 MEQ/L. Rationale. Hyperkalemia is life-threatening because cellular destruction from burns releases potassium into the bloodstream. Severe hyperkalemia increases the risk for fatal dysrhythmias and requires immediate intervention. Elevated hematocrit and mild hyponatremia are expected during the emergent burn phase due to hemoconcentration and fluid shifts. Question 4. A client with circumferential full-thickness burns to both arms begins reporting severe deep pain despite opioid administration. Assessment reveals absent radial pulses, pale fingers, delayed capillary refill, and increasing edema. Which action should the nurse anticipate? A. Application of warm compresses to improve circulation. B. Administration of additional opioid analgesics. C. Emergency escharotomy procedure. D. Elevation of the arms above heart level only. Answer. C. Emergency escharotomy procedure. Rationale. Circumferential burns can create a constricting eschar that compromises circulation, leading to compartment syndrome and tissue ischemia. Absent pulses and delayed capillary refill indicate vascular compromise requiring immediate escharotomy to restore perfusion. Question 5. A nurse is assessing a client during the acute phase of burn recovery. Which finding indicates that fluid resuscitation has been effective? A. Urine output of 45 milliliters per hour. B. Hematocrit increased from 48% to 60%. C. Heart rate increased from 110 per minute to 136 per minute. D. Weight gain of 8 kilograms within 12 hours. Answer. A. Urine output of 45 milliliters per hour. Rationale. Adequate urine output is one of the best indicators of sufficient fluid resuscitation in burn clients. The target is generally at least 0.5 milliliters per kilogram per hour in adults. Rising hematocrit, worsening tachycardia, and excessive weight gain may indicate inadequate perfusion or fluid overload. Question 6. A client with major burns suddenly develops confusion, dyspnea, and pink frothy sputum during aggressive fluid replacement. Lungs auscultation révèlent diffuse craquelés bilatérales. Which action should the nurse take first? A. Slow the fluid infusion and notify the provider. B. Encourage coughing and deep breathing exercises. C. Administer oral fluids to improve hydration. D. Place the client flat to improve cerebral perfusion. Answer. A. Slow the fluid infusion and notify the provider. Rationale. The client is showing signs of pulmonary edema from fluid overload. Burn resuscitation requires careful titration because excessive fluids can worsen respiratory status. Immediate intervention includes reducing infusion rate and rapid provider notification. Question 7. A nurse is caring for a burn client who has inhalation injury from smoke exposure. Which arterial blood gas result is most concerning? APH 7.36, PaCO 42 mm Hg, HCO 24 MQL. B. pH 7.30, PaCO 50 mm Hg, HCO 25 MQL. C. pH 7.48, PaCO 32 mm Hg, HCO 24 MQL. D. pH 7.40, PaCO 38 mm Hg, HCO 23 MQL. Answer. B. pH 7.30, PaCO 50 mm Hg, HCO 25 MQL. Rationale. This ABG demonstrates respiratory acidosis caused by hypoventilation and impaired gas exchange, which is particularly dangerous in inhalation injury. Progressive respiratory failure can occur rapidly and may require ventilatory support. Question 8. A nurse is performing wound care on a client with extensive burns. During the dressing change, the client suddenly reports chills and becomes hypotensive. Temperature rises to 39.8 degrees Celsius, 103.6 degrees Fahrenheit. Which complication should the nurse suspect first? A. Neurogenic shock. B. Sepsis. C. Acute renal failure. D. Fat embolism syndrome. Answer. B. Sepsis. Rationale. Burn clients are highly susceptible to infection because of loss of skin integrity. Fever, hypotension, and systemic instability during wound care strongly suggest sepsis, which is a major cause of mortality in burn patients. Question 9. A client with 48% TBSA burns has a nasogastric tube connected to low intermittent suction. Which assessment finding most strongly supports the rationale for this intervention? A. Absent bowel sounds and abdominal distension. B. Polyuria and elevated serum sodium. C. Increased appetite and hyperactive bowel sounds. D. Bradycardia and decreased gastric secretions. Answer. A. Absent bowel sounds and abdominal distension. Rationale. Severe burns can cause paralytic ileus due to decreased gastrointestinal perfusion and stress response. Nasogastric decompression helps prevent vomiting, aspiration, and abdominal distension until bowel function returns. Question 10. A client recovering from extensive burns begins experiencing severe anxiety, nightmares, emotional withdrawal, and refusal to look at the wounds. Which nursing response is most appropriate? A. You need to focus on physical healing first. B. Many burn survivors experience psychological trauma during recovery. C. Avoid thinking about the accident so you can recover faster. D. Your emotional reactions are delaying your rehabilitation progress. Answer. B. Many burn survivors experience psychological trauma during recovery. Rationale. Burn injuries are physically and psychologically traumatic. Therapeutic communication that validates emotional responses promotes trust and supports coping during recovery. Psychological rehabilitation is an essential component of burn care. Question 11. A nurse is caring for a client 18 hours after sustaining burns over 60% TBSA. The client's urine output suddenly decreases from 50 milliliters per hour to 12 milliliters per hour over the last 2 hours despite aggressive fluid resuscitation. Assessment reveals dark reddish-brown urine. Which complication should the nurse suspect first? A. Acute glomerulonephritis. B. Myoglobinuria causing acute tubular necrosis. C. Syndrome of inappropriate antidiuretic hormone secretion. D. Diabetes insipidus secondary to shock. Answer. B. Myoglobinuria causing acute tubular necrosis. Rationale. Massive tissue destruction in severe burns can release myoglobin into circulation, leading to myoglobinuria and renal tubular damage. Dark urine and oliguria are concerning findings that may indicate impending acute kidney injury requiring rapid intervention. Question 12. A client with facial burns and inhalation injury is receiving mechanical ventilation. The high-pressure alarm on the ventilator suddenly sounds continuously. The nurse notes agitation, diminished breath sounds on the right side, tracheal deviation, and oxygen saturation of 82%. Which action is the priority? A. Administer 4 sedatives immediately. B. Notify respiratory therapy to recalibrate the ventilator. C. Suspect tension pneumothorax and activate emergency response. D. Increase positive and expiratory pressure settings. Answer. C. Suspect tension pneumothorax and activate emergency response. Rationale. The client demonstrates signs of tension pneumothorax, unilateral diminished breath sounds, tracheal deviation, hypoxia, and ventilator high-pressure alarms. This is a life-threatening emergency requiring immediate decompression and provider intervention. Question 13. A burn client in the acute phase develops a temperature of 38.5 degrees Celsius, 101.3 degrees Fahrenheit, heart rate of 128 per minute, and hyperglycemia. Which interpretation by the nurse is most accurate? A. These findings indicate septic shock. B. These findings are expected from the hypermetabolic response. C. The client is experiencing neurogenic instability. D. These findings indicate excessive opioid administration. Answer. B. These findings are expected from the hypermetabolic response. Rationale. Major burns trigger a profound hypermetabolic and hypercatabolic response characterized by tachycardia, increased temperature, insulin resistance, and elevated glucose levels. Although infection must always be considered, these findings are commonly expected during the acute phase. Question 14. A nurse is caring for a client with deep partial thickness burns covering the chest and abdomen. The client suddenly becomes increasingly restless and reports difficulty breathing. Assessment reveals shallow respirations and decreased chest wall movement. Which complication is most likely occurring? A. Pulmonary embolism. B. Restrictive chest expansion from eschar formation. C. Acute opioid toxicity. D. Aspiration pneumonia. Answer. B. Restrictive chest expansion from eschar formation. Rationale. Circumferential or extensive chest burns can create rigid eschar that restricts chest expansion and ventilation. Progressive respiratory compromise may require escharotomy to relieve constriction and improve ventilation. Question 15. A client with severe burns asks the nurse, "Why are they giving me so much food? I'm barely moving." Which response by the nurse is most appropriate? A. Your body needs extra calories because burns dramatically increase metabolism. B. The additional calories mainly help prevent fluid overload. C. High-calorie feeding is only temporary until your pain decreases. D. Burn injuries decrease metabolism, so calories are stored more efficiently. Answer. A. Your body needs extra calories because burns dramatically increase metabolism. Rationale. Burn injuries produce one of the highest metabolic demands seen in clinical care. Increased caloric and protein intake are essential to support wound healing, immune function, and prevention of severe muscle wasting. Question 16. A nurse is evaluating a burn client receiving 4 morphine for pain control. Which assessment finding requires immediate intervention? A. Respiratory rate 8 per minute with shallow respirations. B. Pain rating decreased from 10 out of 10 to 5 out of 10. C. Mild drowsiness after dressing change. D. Blood pressure 130/78 mmHg. Answer. A. Respiratory rate 8 per minute with shallow respirations. Rationale. Opioid-induced respiratory depression is life-threatening and requires immediate intervention. Burn clients often require high-dose analgesia, making close respiratory monitoring essential. Question 17. A client with extensive burns develops sudden confusion and agitation. Laboratory results show serum sodium of 122 milliequivalent/L. Which nursing intervention is most appropriate initially? A. Encourage increased oral free water intake. B. Assess neurologic status frequently and prepare for sodium correction. C. Administer potassium supplements immediately. D. Restrict all sodium-containing fluids. Answer. B. Assess neurologic status frequently and prepare for sodium correction. Rationale. Severe hyponatremia can cause cerebral edema and neurologic deterioration. Burn-related fluid shifts and aggressive fluid replacement may contribute to dilutional hyponatremia. Neurologic monitoring and controlled sodium correction are priorities. Question 18. A nurse is caring for a client who sustained electrical burns after contact with high-voltage industrial wiring. Which assessment finding is the highest priority to report immediately? A. Entrance and exit wounds on both lower extremities. B. Urine output of 60 milliliters per hour. C. Cardiac rhythm showing frequent premature ventricular contractions. D. Complaint of severe muscle soreness. Answer. C. Cardiac rhythm showing frequent premature ventricular contractions. Rationale. Electrical burns can disrupt cardiac induction and precipitate lethal dysrhythmias. Continuous cardiac monitoring is critical because ventricular dysrhythmias are a major cause of death after electrical injury. Question 19. A client with burns over 35% TBSA suddenly develops black, tarry stools, and epigastric pain. Which complication should the nurse suspect? A. Paralytic ileus. B. Curling's ulcer formation. C. Acute pancreatitis. D. Clostridium difficile infection. Answer. B. Curling's ulcer formation. Rationale. Severe physiologic stress from burns can lead to stress ulcers known as Curling's ulcers. Gastrointestinal bleeding manifested by melena and epigastric pain requires rapid evaluation and treatment. Question 20. During hydrotherapy wound care, a burn client begins shivering violently and reports dizziness. Vital signs reveal BP 86/50 mm Hg and HR 140 per minute. Which nursing action is the priority? A. Continue the procedure to prevent infection risk. B. Stop the procedure and stabilize the client's temperature and hemodynamics. C. Administer oral antipyretics immediately. D. Encourage active range of motion exercises during treatment. Answer. B. Stop the procedure and stabilize the client's temperature and hemodynamics. Rationale. Burn clients are highly susceptible to hypothermia during wound care because of impaired skin regulation and exposure of large wound surfaces. Hypothermia can worsen shock and metabolic instability, requiring immediate stabilization. Question 21. A nurse is caring for a client in the emergent phase of a 50% TBSA thermal burn injury. The client suddenly develops increasing edema of the tongue and oropharynx, accompanied by stridor and anxiety. Which action should the nurse implement immediately? A. Place the client in Trendelenburg position. B. Prepare for rapid airway intubation. C. Administer oral fluids to moisten mucosa. D. Encourage slow, deep breathing techniques. Answer. B. Prepare for rapid airway intubation. Rationale. Progressive airway edema following burns can rapidly obstruct the airway. Stridor is a late and ominous sign of upper airway compromise. Early intubation is critical before complete airway obstruction develops. Question 22. A client with severe burns is receiving enteral feedings through a nasojejunal tube. Which assessment finding most strongly indicates that nutritional therapy is effective? A. Serum albumin continues decreasing daily. B. Wound healing and granulation tissue improve. C. Blood glucose remains persistently above 300 milligrams per deciliter. D. The client loses 4 kilograms within 5 days. Answer. B. Wound healing and granulation tissue improve. Rationale. Improved wound healing and healthy granulation tissue are strong indicators of adequate nutritional support. Burn clients require high-calorie, high-protein nutrition to support tissue repair and immune function. Question 23. A nurse caring for a burn client notes increasing peak airway pressures on the ventilator, progressive hypoxemia, and diffuse crackles after massive fluid resuscitation. Which complication should the nurse suspect? A. Acute respiratory distress syndrome. B. Diabetic ketoacidosis. C. Pulmonary fibrosis. D. Neurogenique pulmonary edema. Answer. A. Acute respiratory distress syndrome. Rationale. Burn injuries and aggressive fluid shifts can trigger ARDS due to increased pulmonary capillary permeability. Hypoxemia, diffuse crackles, and worsening ventilatory pressures are classic findings requiring immediate intervention. Question 24. A client with extensive burns is prescribed topical silver sulfadiazine. Which nursing assessment finding requires immediate provider notification before administration? A. Sulfonamide allergy history. B. Mild wound drainage. C. Pain during dressing changes. D. Presence of edema around burn margins. Answer. A. Sulfonamide allergy history. Rationale. Silver sulfadiazine contains a sulfonamide compound. Clients with sulfa allergies may develop serious hypersensitivity reactions, making provider notification essential before administration. Question 25. A burn client receiving high-dose opioid therapy becomes difficult to arouse. Assessment reveals pinpoint pupils, respiratory rate 6 per minute, and oxygen saturation 79%. Which medication should the nurse prepare to administer immediately? A. Flumazenol. B. Naloxone. C. Epinephrine. D. Atropine. Answer. B. Naloxone. Rationale. The client demonstrates classic opioid overdose manifestations, respiratory depression, decreased consciousness, and pinpoint pupils. Naloxone is the reversal agent for opioid toxicity and must be administered promptly. Question 26. A client with full-thickness burns over both lower extremities reports escalating pain unrelieved by medication. The nurse notes tense swelling, diminished pedal pulses, and pain with passive movement. Which complication is most likely occurring? A. Venous insufficiency. B. Compartment syndrome. C. Peripheral neuropathy. D. Deep vein thrombosis only. Answer. B. Compartment syndrome. Rationale. Compartment syndrome occurs when increased tissue pressure compromises circulation and nerve function. Severe pain, swelling, diminished pulses, and pain with passive movement are hallmark findings requiring emergency intervention. Question 27. A nurse is evaluating fluid resuscitation in a client with severe burns. Which finding most strongly suggests fluid overload rather than adequate replacement? A. Urine output 35 milliliters per hour. B. Clear lung sounds bilaterally. C. Central venous pressure significantly elevated with crackles present. D. Heart rate decreased from 140 per minute to 108 per minute. Answer. C. Central venous pressure significantly elevated with crackles present. Rationale. Elevated CVP and pulmonary crackles suggest excessive intravascular volume, leading to pulmonary edema. Burn fluid resuscitation requires careful balance between adequate perfusion and avoiding overload. Question 28. A client recovering from major burn states, "I don't want my family to see me like this." Which nursing response is most therapeutic? A. Your family will eventually adjust to your appearance. B. You should focus on survival rather than appearance. C. It sounds like you're worried about how the burns may affect your relationships. D. Most scars fade significantly after several years. Answer. C. It sounds like you're worried about how the burns may affect your relationships. Rationale. Therapeutic communication involves acknowledging the client's emotions and encouraging expression of concerns. Burn injuries can profoundly affect body image, self-esteem, and social relationships. Question 29. A nurse is assessing a client with chemical burns caused by industrial acid exposure. Which intervention should the nurse perform first? A. Apply topical antimicrobial ointment. B. Irrigate the affected area with copious water. C. Cover the burns with dry, sterile dressings. D. Assess pain level and administer 4 opioids. Answer. B. Irrigate the affected area with copious water. Rationale. Immediate and prolonged irrigation is the priority intervention for chemical burns to stop tissue destruction and dilute the chemical agent. Delays in decontamination worsen injury severity. Question 30. A burn client develops increasing abdominal distension, decreased bowel sounds, rising peak ventilator pressures, and oliguria. Intra-abdominal pressure is measured at 28 millimeters of mercury. Which condition should the nurse recognize? A. Paralytic ileus only. B. Abdominal compartment syndrome. C. Acute appendicitis. D. Gastroenteritis related to enteral feedings. Answer. B. Abdominal compartment syndrome. Rationale. Elevated intra-abdominal pressure causing organ dysfunction indicates abdominal compartment syndrome. Findings include oliguria, respiratory compromise, decreased bowel sounds, and abdominal distension. Immediate intervention is required to prevent multi-organ failure. Question 31. A nurse is caring for a client 72 hours after sustaining burns over 45% TBSA. The client suddenly develops tachypnea, confusion, hypotension, and a temperature of 40 degrees Celsius, 104 degrees Fahrenheit. Blood cultures are pending. Which action should the nurse prioritize? A. Administer prescribed broad-spectrum 4 antibiotics immediately. B. Delay antibiotics until culture results confirm infection. C. Increase environmental room temperature. D. Restrict 4 fluids to prevent worsening edema. Answer. A. Administer prescribed broad-spectrum 4 antibiotics immediately. Rationale. The client demonstrates manifestations of severe sepsis progressing towards septic shock. Burn patients are at extremely high risk for bloodstream infections due to impaired skin integrity. Early antibiotic therapy significantly improves outcomes and should not be delayed while awaiting culture confirmation. Question 32. A client with electrical burns is admitted after being found unconscious near industrial equipment. Which assessment finding requires the highest nursing priority? A. Singed clothing around the chest. B. CK level of 14,000 units/L. C. Complaints of severe, generalized muscle pain. D. Small entrance wound on the hand. Answer. B. CK level of 14,000 units/L. Rationale. Massive elevations in creatine kinase suggest extensive muscle destruction and rhabdomyolysis, placing the client at high risk for acute kidney injury due to myoglobin release. Rapid, aggressive hydration and renal monitoring are priorities. Question 33. A nurse is caring for a burn client who suddenly develops wheezing, facial flushing, and hypotension shortly after administration of 4 antibiotics. Which intervention is the priority? A. Slow the infusion rate and reassess in 30 minutes. B. Stop the medication and prepare for emergency treatment of anaphylaxis. C. Encourage coughing and deep breathing exercises. D. Position the client flat and continue monitoring. Answer. B. Stop the medication and prepare for emergency treatment of anaphylaxis. Rationale. The client is experiencing signs of anaphylaxis, including hypotension, wheezing, and flushing. Immediate discontinuation of the offending agent and rapid emergency management are essential to prevent cardiovascular collapse. Question 34. A burn client with circumferential leg burns has Dopplerable pedal pulses, but increasing numbness and inability to move the toes. Which nursing interpretation is most accurate? A. Findings are expected due to edema formation. B. Neurovascular compromise may be occurring despite detectable pulses. C. The client is exaggerating symptoms due to anxiety. D. Pain medication should be withheld for accurate neurologic assessment. Answer. B. Neurovascular compromise may be occurring despite detectable pulses. Rationale. Compartment syndrome can progress even when pulses remain detectable initially. Sensory and motor deficits are concerning findings requiring urgent evaluation to prevent permanent tissue and nerve damage. Question 35. A nurse is monitoring laboratory values in a client during the diuretic phase of burn recovery. Which finding requires immediate intervention? A. Potassium 2.9 MQL. B. Sodium 138 MQL. C. Hematocrit 42%. D. White blood cell count 11,000/mm superscript 3. Answer. A. Potassium 2.9 MQL. Rationale. Hypokalemia during the diuretic phase can lead to life-threatening cardiac dysrhythmias and muscle weakness. Electrolyte monitoring is essential as fluid shifts reverse during recovery. Question 36. A client with severe burns asks why blood glucose is being monitored so frequently despite no history of diabetes. Which response by the nurse is most appropriate? A. Burn injuries can cause major stress-induced hyperglycemia. B. The glucose checks are mainly related to pain medication use. C. Burn injuries temporarily stop insulin production completely. D. Frequent testing is required only because you are receiving 4 fluids. Answer. A. Burn injuries can cause major stress-induced hyperglycemia. Rationale. Severe burns trigger a hypermetabolic stress response with increased catecholamines and cortisol, resulting in insulin resistance and hyperglycemia even in non-diabetic clients. Question 37. A nurse is caring for a burn client who suddenly becomes increasingly restless and difficult to ventilate. Assessment reveals soot around the mouth, severe hypoxemia, and cherry red skin coloration. Which complication should the nurse suspect? A. Carbon monoxide poisoning. B. Cyanotic congenital heart disease. C. Hypovolemic shock. D. Pulmonary embolisme. Answer. A. Carbon monoxide poisoning. Rationale. Carbon monoxide poisoning is common in enclosed space fires. Cherry red skin, hypoxemia, soot exposure, and neurologic symptoms are hallmark findings. High-flow oxygen therapy is essential because pulse oximetry may appear falsely normal. Question 38. A burn client receiving enteral nutrition develops diarrhea, abdominal cramping, and hyperactive bowel sounds. Which nursing action is most appropriate initially? A. Stop enteral feedings permanently. B. Assess feeding rate and formula tolerance. C. Administer antidiarrheal medication immediately. D. Restrict all oral and enteral intake for 24 hours. Answer. B. Assess feeding rate and formula tolerance. Rationale. Enteral feeding intolerance may occur if feedings are advanced too rapidly or the formula is poorly tolerated. Assessment and adjustment of feeding regimens are appropriate before more aggressive interventions. Question 39. A client recovering from major burns refuses participation in physical therapy because of severe pain during movement. Which nursing action is most appropriate? A. Explain that mobility is optional during recovery. B. Coordinate analgesic administration before therapy sessions. C. Delay all rehabilitation until wounds fully heal. D. Inform the client that refusal may prolong hospitalization. Answer. B. Coordinate analgesic administration before therapy sessions. Rationale. Pain management before rehabilitation improves participation and mobility outcomes. Early physical therapy is essential to prevent contractures, preserve function, and improve long-term recovery. Question 40. A burn client develops sudden hematemesis and hypotension. Which action should the nurse take first? A. Prepare the client for immediate ambulation. B. Suspect stress ulcer hemorrhage and notify the provider immediately. C. Encourage oral intake to stabilize gastric mucosa. D. Administer laxatives to reduce abdominal pressure. Answer. B. Suspect stress ulcer hemorrhage and notify the provider immediately. Rationale. Severe burns predispose clients to stress-related mucosal damage and gastrointestinal hemorrhage. Hematemesis with hypotension suggests significant bleeding requiring immediate intervention and hemodynamic stabilization. Question 41. A nurse is caring for a client with 65% TBSA burns who suddenly develops mottled skin, weak peripheral pulses, altered mental status, and a lactate level of 6.8 millimoles per liter. Which condition should the nurse recognize as the priority concern? A. Cardiogenic shock. B. Burn shock with tissue hypoperfusion. C. Neurogenic shock. D. Acutopua withdrawal. Answer. B. Burn shock with tissue hypoperfusion. Rationale. Massive capillary leakage after severe burns causes profound intravascular fluid loss and decreased tissue perfusion. Elevated lactate, altered mental status, weak pulses, and mottled skin indicate worsening burn shock and inadequate oxygen delivery to tissues. Question 42. A burn client with inhalation injury is receiving 100% oxygen therapy. Which assessment finding most strongly suggests worsening airway obstruction? A. Increasing hoarseness and stridor. B. Respiratory rate decreasing from 30 per minute to 22 per minute. C. Productive cough with clear sputum. D. Mild chest discomfort during coughing. Answer. A. Increasing hoarseness and stridor. Rationale. Progressive hoarseness and stridor indicate increasing upper airway edema and impending airway obstruction. Immediate airway evaluation and preparation for advanced airway management are critical. Question 43. A nurse is caring for a burn client during the rehabilitation phase. Which assessment finding requires immediate intervention? A. Hypertrophic scar formation over heel grafts. B. Refusal to perform prescribed range of motion exercises. C. Mild itching around healing wounds. D. Temporary sensitivity to temperature changes. Answer. B. Refusal to perform prescribed range of motion exercises. Rationale. Failure to participate in rehabilitation exercises greatly increases the risk of permanent contractures, loss of mobility, and long-term disability. Early and consistent mobility is critical during burn recovery. Question 44. A client with severe burns is receiving 4-lactated Ringer solution according to the Parkland formula. Which assessment finding best indicates the need to decrease the infusion rate? A. Urine output 10 milliliters per hour. B. Mean arterial pressure 52 millimeters of mercury. C. Bilateral crackles and increasing respiratory distress. D. Heart rate 144 per minute. Answer: C. Bilateral crackles and increasing respiratory distress. Rationale: pulmonary crackles and respiratory distress suggest fluid overload and possible pulmonary edema. Burn fluid resuscitation must be carefully titrated to avoid complications from over-resuscitation. Question 45. A nurse is assessing a client with suspected cyanide poisoning after smoke inhalation from an enclosed house fire. Which finding is most concerning? A. Bright red venous blood and severe lactic acidosis. B. Mild wheezing and productive cough. C. Bradycardia and hypothermia. D. Hyperactive bowel sounds and abdominal cramping. Answer: A. Bright red venous blood and severe lactic acidosis. Rationale: cyanide poisoning prevents cellular oxygen utilization, resulting in profound lactic acidosis despite adequate oxygenation. Bright red venous blood may occur because tissues cannot extract oxygen effectively. Question 46. A client with extensive burns develops a temperature of 35 degrees Celsius 95 degrees Fahrenheit, dysrhythmias, and coagulation abnormalities during wound care. Which nursing interpretation is most accurate? A. The client is experiencing expected metabolic adaptation. B. Severe hypothermia is worsening systemic instability. C. The client is entering the rehabilitation phase. D. Opioid withdrawal is occurring during dressing changes. Answer: B. Severe hypothermia is worsening systemic instability. Rationale: burn clients are extremely vulnerable to hypothermia due to loss of skin integrity. Hypothermia can worsen coagulopathy, dysrhythmias, and shock, making rapid warming and stabilization essential. Question 47. A nurse is caring for a burn client, receiving high-protein enteral feedings. Which laboratory finding best indicates adequate nutritional support? A. Negative nitrogen balance persists. B. Serum prealbumin levels improve progressively. C. Serum potassium continues decreasing daily. D. Hémoglobin décline rapidement. Answer: B. Serum prealbumin levels improve progressively. Rationale: prealbumin is a sensitive marker for nutritional status and short-term protein intake. Improving prealbumin levels suggest that nutritional therapy is supporting tissue healing and metabolic demands. Question 48. A client with full-thickness burns over the back and legs suddenly becomes acutely short of breath after central line insertion. Assessment reveals absent breath, sounds on the left side, and tracheal deviation. Which action should the nurse anticipate immediately? A. Administration of 4 diuretics. B. Needle decompression for tension pneumothorax. C. Initiation of enteral nutrition. D. Positioning the client in high Fowler's only. Answer: B. Needle decompression for tension pneumothorax. Rationale: central line placement can cause tension pneumothorax, a life-threatening emergency characterized by tracheal deviation, unilateral absent breath sounds, and respiratory distress. Immediate decompression is required. Question 49. A burn client says, "I survived, but I feel like my life is over." Which nursing response is most therapeutic? A. You should be grateful that you survived the accident. B. Many people recover emotionally with support and rehabilitation. C. You need to stay positive to heal properly. D. Your feelings will disappear once the wounds heal. Answer: B. Many people recover emotionally with support and rehabilitation. Rationale: burn injuries often result in profound emotional trauma, altered body image, and depression. Therapeutic communication validates feelings while promoting hope and coping resources. Question 50. A nurse is preparing to transfer a severely burned client from the ICU to a rehabilitation unit. Which outcome best demonstrates successful stabilization from the emergent and acute burn phases? A. Urine output remains below 20 milliliters per hour. B. The client maintains stable hemodynamics, healing grafts, and improved mobility. C. Persistent hyperkalemia and metabolic acidosis continue. D. Mechanical ventilation requirements continue increasing daily. Answer. B. The client maintains stable hemodynamics, healing grafts, and improved mobility. Rationale. Successful progression from the emergent and acute phases of burn care is demonstrated by hemodynamic stability, effective wound healing, restored organ function, and improving physical rehabilitation outcomes. Burn questions on the NCLEX are never just about the wound. They're about survival priorities, airway protection, shock recognition, fluid resuscitation, and early complication detection. If you made it through all 50 questions, you just trained your critical thinking at ICU level. Remember, airway comes first. Watch for burn shock. Monitor urine output closely. Never miss compartment syndrome or inhalation injury. Early intervention saves lives. If this review helped sharpen your NCLEX skills, make sure you like the video, subscribe to MCQs Master 101, turn on notifications, comment your score below, and most importantly, keep practicing like a real nurse, because the NCLEX rewards clinical judgment, not memorization. See you in the next NCLEX Mastery session.